What if I told you that your body has been warning you about kidney failure for months, maybe even years, and every single sign was visible, readable, and completely ignored? Not because you were careless, but because nobody ever sat you down and explained what to look for? That changes today, right now. In the next few minutes, everything you thought you knew about your health is going to shift. Because the kidneys are the most underestimated, most misunderstood, most dangerously overlooked organs in the entire human body, and the tragedy is that they give you signs. Real, physical, visible signs. But the medical world speaks in a language that ordinary people were never taught to understand. Let me start with something that will shake you to your core: your kidneys. Those two bean-shaped organs sitting quietly behind your lower back filter approximately 200 liters of blood every single day. Every toxin, every waste product, every chemical imbalance in your body passes through them. They regulate your blood pressure. They produce the hormone that tells your bone marrow to make red blood cells. They activate vitamin D so your bones don't crumble. They balance every mineral, sodium, potassium, phosphorus, with mathematical precision. They are doing all of this right now, silently, without a single complaint. And here is the terrifying part. They can lose up to 90% of their function before you feel even one noticeable symptom. 90% gone. And you would still be walking around thinking everything is fine. This is not a coincidence. This is biology. The kidneys are so resilient, so committed to keeping you alive, that they compensate and adapt and stretch their remaining capacity to the absolute limit before they finally break down. And by the time they break down, by the time the symptoms become impossible to ignore, you are already in what doctors call end-stage renal disease. And at that point, the only options left are dialysis, transplant, or death. That is the brutal reality. And that is exactly why what I am about to share with you is not optional information. This is survival information. Foamy or bubbly urine. What if the foam in your toilet bowl is not just trapped air? What if it is protein? What if your kidneys, which are supposed to keep protein safely inside your blood, have become so damaged that they are leaking it out like a broken filter? And that foam you flush away every morning is actually your body losing the very building blocks it needs to heal itself? Healthy kidneys act like precision sieves. They allow water and waste to pass through, but hold back large molecules like albumin and protein. When the filtering membranes of the kidney, called glomeruli, become inflamed or scarred, they develop holes, microscopic tears, and protein begins slipping through. When protein hits the water in your toilet bowl, it creates surface tension, exactly like soap. And you see persistent bubbles that don't disappear even after several minutes. This is called proteinuria, and it is one of the earliest, most detectable signs of kidney damage that exists. And yet millions of people see it every single day and assume it's nothing. The foam doesn't lie. Your toilet bowl is trying to give you a diagnosis. One simple urine test, a dipstick test that costs less than $1, can confirm whether protein is present. If you have been seeing foam consistently for more than 2 weeks, that is not normal. That is a medical emergency disguised as a bathroom moment. Changes in urine color. What if the color of your urine, something you glance at and forget in 3 seconds, is actually a medical report that your body generates multiple times a day for free? And most people have been throwing that report in the trash without reading it? Normal urine should be pale, yellow to amber, depending on how hydrated you are. But when the kidneys begin failing, the color of urine changes in dramatic and specific ways that carry precise medical meaning. Dark brown or cola-colored urine can indicate blood in the urine, a condition called hematuria, which occurs when the damaged kidney filters allow red blood cells to pass through into the urine. This can happen in glomerulonephritis, kidney stones, or serious kidney infections. Pink or reddish urine, even faintly, should never be ignored because just 1 milliliter of blood is enough to visibly change the color of your entire urine output. Orange urine can indicate severe dehydration combined with kidney stress, where the kidneys are concentrating waste so aggressively that the pigments become visible. Cloudy urine indicates the presence of white blood cells, bacteria, or pus, which points to kidney infection, also known as pyelonephritis, a condition that can permanently scar kidney tissue if untreated. And completely colorless urine, completely clear, while it might seem like a sign of good hydration, can actually indicate that the kidneys have lost their ability to concentrate urine, a dangerous sign of early kidney failure called isostenuria. Every color variation matters. Every change in shade is a message. The question is whether you have been listening. Swelling in the ankles, feet, and legs. What if the puffiness around your ankles that you casually rub away at the end of a long day is not tiredness? What if it is your kidneys silently drowning in their own failure, unable to remove the excess sodium and fluid that is now pooling in your lower extremities because gravity has no mercy? The kidneys play an absolutely central role in fluid balance. Every day, they decide how much water stays in the body and how much gets excreted as urine. When kidneys are damaged, they begin retaining sodium, and where sodium goes, water follows, because sodium is osmotically active, meaning it pulls water toward itself like a magnet. This excess fluid has to go somewhere, and because of gravity, it settles in the lowest parts of the body first: the ankles, the feet, the calves. The medical term is peripheral edema, and it is visually unmistakable. If you press your thumb firmly into the swollen area for about 5 seconds and release it, and the indentation remains, that is called pitting edema, and it is a physical sign that fluid has accumulated in the tissue. As kidney function deteriorates further, this swelling can travel upward, into the abdomen, causing a condition called ascites, and even into the lungs, causing pulmonary edema, which is a life-threatening emergency where the patient literally feels like they are drowning from the inside. What begins as slightly tight shoes in the evening can end in an intensive care unit. The body always tells the truth. We simply need to ask the right questions. Persistent puffiness around the eyes. What if the bags under your eyes that you cover with makeup every morning, that you blame on poor sleep or allergies, are not cosmetic? What if they are your kidneys announcing their failure in the most visible location on your entire face? The puffiness around the eyes, particularly the lower eyelids, that appears specifically in the morning and improves somewhat as the day goes on, is called periorbital edema, and it is one of the classic early signs of nephrotic syndrome, which is a kidney disorder characterized by massive protein loss in the urine. Here is the biological mechanism that makes this so shocking. When the kidneys leak protein through damaged filters, the protein level in the blood drops significantly. Protein, specifically albumin, is responsible for maintaining what is called oncotic pressure, the force that keeps fluid inside the blood vessels. When protein levels drop, this pressure drops, and fluid leaks out of the blood vessels into the surrounding tissues. Because the skin around the eyes is the thinnest and loosest skin on the entire human body, it swells first. It swells most visibly. It swells in a way that is different from ordinary tiredness-related puffiness. It is firmer, more persistent, and it doesn't respond to cold compresses or extra sleep the way normal eye bags do. The ancient physicians. The physicians who had no laboratory tests and no imaging machines called this sign nephritic facies, the kidney face, because they recognized thousands of years ago that the eyes reveal what the kidneys are hiding: extreme fatigue and weakness. What if you have been telling yourself you are simply tired, overworked, stressed, aging, when the truth is that your kidneys have been poisoning your blood for months, and the exhaustion you feel is not in your mind but in your biology, in the very chemistry of your blood? The kidneys produce a hormone called erythropoietin, also known as EPO, which travels through the blood to the bone marrow and signals it to produce red blood cells. Red blood cells carry oxygen. Every cell, every muscle, every organ in your body depends on that oxygen delivery system to function. When the kidneys are damaged and EPO production drops, the bone marrow produces fewer red blood cells, and the result is a condition called renal anemia. With fewer red blood cells circulating, less oxygen reaches the muscles, the brain, and the heart. The muscles feel heavy, weak, and exhausted even after minimal activity. The brain becomes foggy, slow, and unable to concentrate. The heart has to pump harder to compensate, which over time damages the heart as well. This is not psychological fatigue. This is cellular oxygen starvation. And the frightening part is that it develops so gradually. The body adapts so incrementally that patients often don't realize how profoundly exhausted they have become until someone asks them to compare their energy levels from 1 year ago to today. And the difference is devastating. Fatigue that does not improve with rest. Fatigue that has no obvious cause. Fatigue that is accompanied by shortness of breath with minimal exertion. This is your kidney talking to you in the language of exhaustion, shortness of breath. What if the breathlessness you experience when climbing a simple flight of stairs, the breathlessness that embarrasses you, that you laugh off as being out of shape, is actually your damaged kidneys flooding your lungs with fluid and leaving your blood starved of oxygen? And it has nothing to do with your fitness level at all? Shortness of breath and kidney disease occurs through two distinct and equally dangerous mechanisms. The first is the anemia mechanism, where reduced red blood cells mean reduced oxygen delivery, and the body, desperate for air, increases its breathing rate to try to extract more oxygen from each breath. But the problem is not the lungs. The problem is the blood, and no amount of deep breathing solves a red blood cell deficiency. The second mechanism is fluid overload, where the failing kidneys cannot remove excess fluid, and that fluid backs up into the lungs, filling the tiny air sacs called alveoli with liquid, creating a condition called pulmonary edema. Patients describe this sensation as breathing through wet cement, as if someone is pressing a pillow over their face, as if the air exists but somehow refuses to enter. This can develop suddenly and severely at night, causing a patient to wake from sleep in absolute terror, gasping, sitting upright because lying flat makes the breathlessness unbearable, a phenomenon doctors call orthopnea. When breathlessness combines with swelling, fatigue, and foamy urine, the kidneys are not slowly declining, they are collapsing. Persistent itching and dry skin. What if the itch that drives you insane at night? The itch that has no rash, no visible cause, no logical explanation, is not a skin problem at all. What if it is your kidneys failing to clear phosphorus from your blood, and that phosphorus is now crystallizing in your skin and triggering a nerve response that no cream, no antihistamine, and no dermatologist can fix? Healthy kidneys continuously filter excess phosphorus and excrete it in the urine. When kidney function declines, phosphorus accumulates in the bloodstream, a condition called hyperphosphatemia. Phosphorus then binds with calcium to form calcium phosphate crystals that deposit in the skin and subcutaneous tissue. These crystals irritate the nerve fibers in the skin, triggering an intense, unrelenting itch that has no physical scratch point, meaning scratching provides zero relief because the irritation is coming from inside the tissue, not the surface. This type of itch, called uremic pruritus, is one of the most psychologically distressing symptoms of advanced kidney disease. Patients scratch themselves bloody. They cannot sleep. They cannot sit still. They are itching from something invisible, something internal, something that is poisoning them molecule by molecule. The skin also becomes progressively dry, cracked, and yellowed because the kidneys can no longer properly regulate hydration because vitamin D activation is failing, and because waste products called uremic toxins are accumulating in the blood and being excreted through the skin in the only exit left available to them: metallic taste in the mouth and ammonia breath. What if the strange metallic taste that has been sitting on your tongue for weeks, the taste that makes food unappealing and your morning breath unbearable, is not caused by your diet, not caused by your toothpaste, not caused by vitamins or stress, but caused by urea, the primary waste product of protein metabolism accumulating in your saliva, because your kidneys are no longer clearing it from your blood? When kidneys fail, urea, which should be filtered and excreted in urine, builds up in the bloodstream to dangerous levels, a condition called uremia, from the Latin meaning urine in the blood. The body, in a desperate attempt to remove some of this excess urea, begins excreting it through every available channel, including the salivary glands. When urea reaches the mouth, it is broken down by bacteria in the saliva into ammonia, which produces the distinctive, sharp, pungent breath that kidney patients and their families describe as smelling like urine, like bleach, like a public restroom. This is called uremic fetor, and it is a sign that the blood toxin level has reached a critical threshold. The metallic taste accompanying this occurs because high urea levels directly affect the taste receptors on the tongue, chemically altering the perception of flavor, making food taste like metal, like pennies, like blood, which causes severe loss of appetite, nausea, and ultimately profound malnutrition in kidney patients. Nausea, vomiting, and loss of appetite. What if the nausea you experience every morning, the nausea that has made you avoid eating, that has caused you to lose weight without trying, that you have been attributing to anxiety or a sensitive stomach, is actually uremic toxins in your blood activating the vomiting center in your brain, because your body is so poisoned that it is trying to physically expel the toxins through your stomach, even though the toxins are in your blood, not your food? As the kidneys lose their filtration capacity, over 90 different uremic toxins accumulate in the bloodstream. Many of these toxins cross the blood-brain barrier and directly stimulate the chemoreceptor trigger zone in the brain, the same zone that causes nausea during chemotherapy, during pregnancy, during poisoning. The brain, detecting that the blood chemistry is dangerously altered, triggers nausea and vomiting as a protective reflex. The stomach lining also becomes irritated by high urea concentrations, a condition called uremic gastritis, which causes persistent indigestion, bloating, and a complete loss of desire to eat. Patients stop eating not because they are depressed or dieting. They stop eating because eating makes them feel violently ill. This leads to severe protein energy malnutrition, which then accelerates kidney damage further, creating a catastrophic downward spiral where the nausea prevents eating. The malnutrition weakens the kidneys, the weaker kidneys produce more toxins, and the more toxins produce more nausea. A biological death spiral that can only be broken with medical intervention. What if everything you just heard, every single sign, every biological mechanism, every warning your body has been broadcasting, could be the information that saves your life or the life of someone sitting beside you right now? I want you to understand something fundamental. The kidneys are not fragile. They are extraordinarily powerful, remarkably resilient, and almost heroically committed to keeping you alive. They endure enormous damage and continue working without complaint for years. But they are not indestructible, and when they finally reach their limit, the consequences are swift, severe, and permanent, unless you act before that moment arrives. The 17 signs we discussed today: the foamy urine, the color changes, the swelling, the eye puffiness, the unbearable fatigue, the breathlessness, the itching, the metallic taste, the nausea, the cramps, the urination changes, the resistant hypertension, the bone pain, the brain fog, the chest pain, the skin changes, and the specific back pain. None of these signs appeared overnight. Each one developed slowly, progressively, over months or years. Each one was a checkpoint, a door that your body held open for you to walk through and seek help. The question is not whether the signs were there. They were always there. The question is whether you were given the knowledge to recognize them. And now you have that knowledge. And knowledge in the right hands at the right moment is not just information, it is salvation. Go today. Have your kidney function checked. A simple blood test measuring creatinine and GFR combined with a urine test for protein. These are inexpensive, accessible tests that can be done at any clinic. And they can tell you with complete precision where your kidneys stand right now. If everything is fine, celebrate that information and take better care of them going forward. Stay hydrated. Reduce your salt, your sugar, your processed foods. Manage your blood pressure and your diabetes if you have them. Avoid overusing painkillers, particularly NSAIDs like ibuprofen and diclofenac, which are devastatingly toxic to kidney tissue with long-term use. If something is not fine, if those tests come back with abnormal numbers, be grateful that you found out now, at a stage where intervention is still possible, where the downward spiral can still be reversed, where your kidneys can still be protected and preserved. The worst outcome is not a bad test result. The worst outcome is never taking the test at all. Your kidneys have been faithful to you every minute of every day of your entire life. They have filtered everything you have ever eaten, drunk, breathed, or absorbed. They have asked for nothing in return. Today, for the first time perhaps, you have the chance to be faithful to them.